What is a craniotomy for brain tumor resection? A craniotomy for brain tumor resection is a surgical procedure where a neurosurgeon removes a part of the skull to access the brain. This allows the surgeon to remove all or part of a brain tumor while trying to preserve healthy brain tissue. The procedure starts with the patient under general anesthesia, meaning they are asleep during the operation. The surgeon makes an incision in the scalp, often behind the hairline, to keep the cosmetic impact minimal. After lifting the skin and muscles, the surgeon uses specialized drills to create small holes in the skull. They then cut a section of the skull, called a bone flap, which is temporarily removed. This exposes the dura mater, a tough membrane that covers the brain. The dura is then opened to allow access to the brain tissue beneath it. To enhance precision, advanced technologies like operating microscopes and computer-assisted navigation are used. These tools help the surgeon locate the tumor and differentiate it from healthy brain tissue. In some cases, if the tumor is near critical areas of the brain, an awake craniotomy may be performed. During this type of surgery, the patient is woken up to perform specific tasks. This helps the surgeon avoid damaging important brain regions responsible for functions like speech or movement. Once the tumor is removed as much as safely possible, the dura mater is closed, and the bone flap is replaced and secured with titanium plates and screws. The scalp incision is then sutured closed. Over time, the bone flap heals, and the hardware remains in place permanently. Craniotomy is the most common surgical approach for brain tumors. It is used not only for tumor removal but also for obtaining tissue samples, known as biopsies. The main goal of this surgery is to remove as much of the tumor as possible while minimizing harm to surrounding brain tissue. This is crucial for maintaining brain health and function. Preparation for a craniotomy includes preoperative assessments and imaging studies to ensure the best outcomes. Recovery involves monitoring for potential complications like infection, bleeding, or neurological changes. Interestingly, the brain itself does not feel pain during the procedure because it lacks pain receptors. However, the surrounding tissues do feel pain, which is why anesthesia and careful surgical techniques are essential. In summary, a craniotomy for brain tumor resection is a well-planned surgery that temporarily removes a section of the skull to safely access brain tumors. The aim is to maximize tumor removal while preserving brain function, ultimately supporting brain cancer treatment and overall brain health. Always consult healthcare professionals for personalized medical advice.